The CDC now recommending that just about everyone 6 months and older get that updated COVID vaccine for the fall. The FDA approving the new vaccines from both Moderna and Pfizer on Monday. Authorities are no longer calling these shots boosters, but instead updated vaccines. Public health officials are hoping to make the COVID vaccine a regular shot that targets a specific variant, which would be just like the annual flu shot you get. The first supplies, they say, could be available within 48 hours. Our science and health correspondent Lindsay Thies is live in San Francisco. And Lindsay, tell us more about these vaccines and the recommendations from the CDC.
The recommendations just getting signed off, almost 30 minutes ago now by CDC Director Mandy Cohen, saying that they are tools to prevent us from having the worst outcomes when it comes to COVID-19. And we are seeing cases, we are seeing diagnoses spike across the country, hospitalization, death rates also going up, lower overall compared to years past. But still, as we know, when we have this circulating in the community, many of us don't want to get sick, period, let alone get a moderate or severe case if we can avoid it. And that's what these vaccines aim to do. This updated vaccine, like you said, no longer being called a booster, an updated vaccine. The monovalent strain that was selected for it was selected earlier this summer, authorized and approved, depending on the different age group specifics, by the FDA yesterday, and then these recommendations coming through from the CDC. There's a lot of different specifics depending on age, vaccination status. So we're going to throw a few lists up on the screen. If you're watching right now at home or on your smart device, go ahead and take a look so we can show you kind of who's eligible for what. So according to these new CDC recs, if you are someone who's 5 and older, you are eligible for a single dose, especially if it's at least 2 months since the last dose of any COVID vaccine that you've had. And then when it gets down to these younger age groups, kids are not tiny adults, so it's a little more specific for the 6 months to 4-year-olds. Take a look if you're previously vaccinated, it's 1 or 2 doses depending on, the previous doses of vaccine, what type of COVID vaccine was received. If it's an unvaccinated kiddo, you're looking at 3 doses of that updated Pfizer-Biontech shot or 2 doses of the updated authorized Moderna COVID-19 vaccine. Also want to note that there is a vaccine candidate from Novavax that's kind of been in the mix here, but it's not yet authorized or approved. But the way that the CDC recommendation has come down, they didn't name specific vaccine makers, but rather the vaccine that targets this XBB 1.5. Another thing that was new to this meeting from the recommendations from the CDC are those who are moderately or severely immunocompromised. So for someone to be up to date with their shots on that, you're talking an initial Moderna or Pfizer series of COVID shots or boosters and an updated shot. And then at that point, it's up to the individuals and their doctors, their nurse practitioners, if they are a good fit for additional doses of that updated COVID-19 vaccine, Dal.
Lindsay Thies, live from San Francisco for us. Lindsay, as always, thank you very much. Let's get more on it now from Dr. Amish Adalja with Johns Hopkins University. He is a frequent guest on this program and has been front and center in our fight against the virus. Dr. Adalja, as always, thanks for being with us. First of all, your thoughts on this new vaccine?
This is something that was expected to be approved. We know that this virus has mutated away from the current version of the vaccine, and when it comes to high-risk individuals, having a better matched vaccine is going to give them more protection. So this is something that I think is good news for those individuals in the high-risk category. I think for the lower-risk category, it's kind of plus-minus, just like all the other versions of this vaccine have been in the boosters, but it is something that will keep people out of the hospital if they have a risk for hospitalization.
Let me ask the question then that the people in the lower risk category are going to ask. If I get the shot, will I get sick? Which is the question they ask about the flu vaccine. And if I don't get the shot, how sick will I get?
So when you think about COVID-19, the vaccines really at this point don't prevent infection except for a temporary period of time. So a couple of months max, probably, from when you get the vaccine shot. It's going to be very difficult for the current version of the virus to infect you. The virus could change and it could be able to infect you despite the new vaccine. But it's usually a couple of months. So it's kind of like temporary, transient, kicking the can down the road, and then you're going to become susceptible to infection. If you're low risk, meaning you don't have any high risk factors, including being overweight, diabetic, lung, heart disease, pregnant, immunocompromised, all the things that we heard about, and I especially want to emphasize being overweight, then I think your risks of severe disease are very low. But remember to really think about whether you have a risk factor for severe disease before you kind of bless yourself with that kind of idea that you don't have any risk factors for severe disease, because many people don't recognize that their weight may be the risk factor for severe disease, or their mildly elevated blood pressure might be a risk factor for severe disease.
Dr. Adoja, I actually did a double take when I was reading the CDC's guidelines. 6 months and older. I thought that was very young compared to the way we saw the other vaccines being rolled out, specifically the ones from Moderna and Johnson & Johnson, and also from Pfizer early on. If I am a parent of a 6-month-old child, an infant, should I contact my physician before getting the shot?
Well, I think you should discuss these types of things with your physician, but in general, this is a safe vaccine even for that small age group. And we know that there are some children that have risk factors for severe disease. So if your child has never been vaccinated, I think it's important that they get vaccinated. This should be a routine vaccination. How frequently we need to boost and update, that's a separate question. But I think everybody should get vaccinated, especially if you're a parent of a newborn. That's something that's important for your child to get.
With regards to adverse reactions, are there any?
Well, we know that anytime you get a vaccine, you're going to get a sore arm, muscle aches and pains, maybe some fevers, fatigue. That's usual. There aren't really any major side effects that occur with this vaccine. There have been reports of myocarditis, but it seems to be not so common now. With this fall booster campaign that we had last fall, it didn't really seem to be a very major issue. Myocarditis does occur in individuals that are usually males that are in their late teens to early 20s, and it's something that's fairly mild, although it can be scary. It's something that can be easily managed, but it doesn't seem to be as much of an issue with these single-dose booster vaccines or updated vaccines as it was with the original series. So I really think that the risk-benefit ratio favors this vaccine in almost all scenarios.
Dr. Adoja, as I indicated when I introduced you, we have been doing this now for quite some time, for years, in fact. Now the latest Omicron subvariant is Parola, according to the new data that we're getting. But as you see where we are right now, compared to where we used to be, is it time for science to take a day just to celebrate the fact that maybe we're looking at COVID in the rearview mirror?
I do think it's important to see how manageable COVID has become over the past 3 years, how many tools that we have now for COVID that we didn't have and wish we had for other viruses. And it is a major triumph of science and medicine in terms of record-breaking speed vaccines, antivirals that are highly potent, home tests, wastewater monitoring, and tons of knowledge that we have at the bedside to take care of these patients. So I do think the fact that we are seeing excess deaths come down to normal, we're not hearing about hospitals in crisis, that is really a testament to the work that the scientific community put in to tame this virus that wasn't even known to science before 2019.
Dr. Adoja, final question before I let you go. Is it too soon to tell whether or not this shot, like so many other shots that we've had over the past 3.5 years, will be for free?
It's most likely going to be something that its out-of-pocket cost is zero to anybody that wants it. Medicare, Medicaid are going to cover it. Insurances are going to cover it because now it has an ACIP recommendation. And for those that don't have insurance, this is something that they're going to be programs both by Moderna and Pfizer, as well as the federal government, and you'll see health departments and federally qualified health clinics, which will have ample vaccine for people who want to get it with zero out-of-pocket cost.
Dr. Adoja, I had to chuckle when you coughed, because I remember in the early days of the pandemic, you would cough and people would run in the other direction, no matter where you were, in a grocery store, a movie theater, or et cetera. Dr. Amish Adoja from Johns Hopkins University in Pittsburgh, Pennsylvania. Doctor, thanks for being with us.